What is attention deficit hyperactivity disorder, ADHD? Attention deficit hyperactivity disorder, ADHD, is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. ADHD commonly begins in childhood and can continue into adolescence and adulthood, though its symptoms may evolve over time. Core symptoms of ADHD. The symptoms of ADHD fall into two main categories: inattention and hyperactivity/impulsivity. 1. Inattention. Difficulty sustaining attention in tasks or activities. Frequently makes careless mistakes in schoolwork, work, or other activities. Trouble organizing tasks and managing time effectively. Often loses items needed for tasks, e.g., keys, school supplies. Easily distracted by external stimuli or unrelated thoughts. Appears forgetful in daily activities. 2. Hyperactivity/impulsivity. Fidgeting, tapping hands or feet, or inability to sit still. Leaving a seat when remaining seated is expected. Excessive talking or interrupting others. Difficulty waiting for their turn in activities or conversations. Engaging in activities or speaking without considering consequences. Feeling constantly on the go or driven by an internal motor. Types of ADHD. ADHD is classified into three subtypes based on the predominant symptoms. 1. Predominantly inattentive presentation. Symptoms of inattention are most prevalent. More common in girls and may go unnoticed for longer. 2. Predominantly hyperactive impulsive presentation. Hyperactivity and impulsivity are the main features. More common in younger children, especially boys. 3. Combined presentation. A mix of significant symptoms of both inattention and hyperactivity/impulsivity. Causes and risk factors. The exact cause of ADHD is not fully understood, but it is thought to result from a combination of genetic, neurological, and environmental factors. 1. Genetic factors. ADHD tends to run in families, indicating a strong genetic component. 2. Brain structure and function. Differences in brain regions involved in attention, impulse control, and executive functions, e.g., the prefrontal cortex. Imbalance of neurotransmitters, such as dopamine and norepinephrine. 3. Environmental factors. Exposure to toxins, e.g., lead, during pregnancy or early childhood. Premature birth or low birth weight. Maternal smoking, alcohol use, or drug use during pregnancy. 4. Other factors. Early adversity, such as trauma or stress. Poor sleep or inconsistent routines. Diagnosis of ADHD. ADHD is diagnosed based on clinical criteria outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. The process involves 1. Comprehensive history. Gathering detailed information about behavior patterns at home, school, and social settings. Family history of ADHD or related conditions. 2. Behavioral assessment. Use of standardized rating scales and questionnaires for parents, teachers, and the individual. 3. Duration and impact. Symptoms must be present for at least 6 months and be inappropriate for the individual's developmental level. Symptoms must cause significant impairment in social, academic, or occupational functioning. 4. Exclusion of other conditions. Rule out other potential causes such as anxiety, depression, learning disorders, or sleep disorders. Treatment of ADHD. ADHD treatment involves a multimodal approach, including behavioral therapy, medications, and lifestyle changes. 1. Behavioral therapy. Parent training helps parents manage challenging behaviors and improve communication. Cognitive behavioral therapy, CBT, focuses on managing impulsive behaviors and improving organizational skills. Social skills training helps children develop appropriate social interactions. 2. Medications. Stimulants, the most common treatment, includes medications like methylphenidate, e.g., Ritalin, and amphetamines, e.g., Adderall. Non-stimulants, options like atomoxetine, Strattera, or guanfacine for those who cannot tolerate stimulants or for additional symptom control. 3. Educational interventions. Individualized education plans, IEPs, or 504 plans in schools to provide accommodations, such as extra time for tasks or a quieter workspace. 4. Lifestyle modifications. Structure and routine. Consistent daily schedules help manage symptoms. Healthy diet. Nutritional balance supports brain function. Regular physical activity. Exercise can improve focus and reduce hyperactivity. Adequate sleep. Ensuring proper sleep hygiene is critical for managing symptoms. Managing ADHD in different age groups. 1. Children. Focus on structured environments and positive reinforcement. Parent-teacher collaboration is essential for school success. 2. Adolescents. Encourage self-management skills and responsibility for medication and routines. Address potential challenges with peer relationships and academic demands. 3. Adults. Treatment focuses on managing work, relationships, and daily responsibilities. Coaching and therapy may help with time management and organizational skills. Challenges and complications. If left untreated, ADHD can lead to academic underachievement, difficulties in relationships and social interactions, increased risk of anxiety, depression, and low self-esteem, higher likelihood of substance use or risk-taking behaviors in adolescents and adults. Prognosis and outlook. With proper treatment and support, individuals with ADHD can lead successful and fulfilling lives. Early intervention, tailored therapy, and supportive environments play a crucial role in managing symptoms effectively.